Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show, bringing another really awesome guest today involved in creating a better tomorrow for many folks out there. Today, we have the honor of being joined on the show by Danielle Halstrom, who is president of the GE HealthCare Foundation. This is a philanthropic foundation arm of GE HealthCare. It's focused on supporting nonprofit organizations looking to make healthcare more accessible, personal, human, and flexible, and ultimately striving to remove the barriers that separate various underserved communities from equitable healthcare. With their initial focus on improving maternal health outcomes globally, the foundation is addressing this really critical need that we've profiled a bit on previous shows, that sadly every 2 minutes somewhere a woman dies due to pregnancy or childbirth-related complications, and that compounded by really severe shortages of primary care and midwifery professionals worldwide causes a major problem that needs to be addressed. And then GE HealthCare is, of course, a leading global medical tech company. They're also involved in digital solutions innovation, ultimately enabling clinicians to make faster, more informed decisions through their different products and services. Prior to this role, Danielle was a chief communications and corporate marketing officer at GE HealthCare. Prior to that, senior vice president, head of comms at the biotechnology Zai Lab, also at Bristol Myers Squibb as vice president and head of commercial research and development and manufacturing comms, including patient advocacy roles. And then prior to that, served various roles as senior director and leader of global colleague communications at Pfizer, director of product communications at GSK, and started out as manager in the U.S. healthcare business of public affairs at Merck. She has a background in English from the College of St. Benedict. A lot of really interesting topics to get into today that we don't normally touch on, but we're honored to have her. Danielle Halstrom, thank you so much for taking time to come on the show.
Well, Ira, very nice to be here. Thank you so much for your interest in GE HealthCare and our new foundation.
It's a really interesting set of topics. And I'm looking to get into it, but I would love to start off, talking about you a bit. You have a really interesting background. Would love to hear your story a little bit more on sort of everything from, where you grew up, how you got interested in English, of course, and communications, but you went fast and furious, not just into healthcare, but into pharma comms. I come out of the pharma industry, so it's exciting to me. What got you started on this path?
Honestly, hearing you go through my background was a little bit exhausting. It makes me feel like I'm not just accomplished, but old. So I grew up in Minnesota. My dad was an airline pilot. And so I, spent the first 20 years of my life in Minnesota, really loved growing up there. Had a very, I would say, idyllic childhood. I became interested in healthcare when, I started off thinking I was going to be a book editor. I started off working for McGraw-Hill Book Company. That didn't pan out so well. And so we moved to Indianapolis, my husband and I started a job with Eli Lilly and Company, my first job in the industry, and really just became exposed to so much in the communications world. I fell in love with the industry. It was at a time when Lilly had launched Prozac and was making just such a huge impact on the lives of people with depression. And I saw the power of what the industry could do. And so I, really sort of committed to healthcare. Fast forward, I moved through a number of of companies, a number of different roles. I often say there's no job in communications that I didn't do. And, just really saw the power of partnering with patients. Anytime you put the patient at the center of a decision, it makes the decision far easier to make. It all sort of, idea of competition and who's winning, who's losing kind of thing falls to the wayside because you're putting somebody and their healthcare at the center of what you're doing. And so I'm a big believer in the power that we have as the healthcare industry to really advocate for patients.
Mm-hmm.
So, as you say, I spent 25 years in the pharmaceutical industry. I loved working for every one of those companies, learned a ton along the way, learned more and more about what we could do as an industry to improve care for patients and to be on the patient's side. So fast forward, I landed Bristol Myers Squibb. I'm in a job that I love. I'm leading, large teams of wonderful people who are focused on, communicating the benefits of what the company is doing for patients. Also led patient advocacy, which was just, kind of a very formative experience and something I really feel honored to have done. It was in that role that when COVID hit.
Yep.
And, at that time, I'm sure you, like everybody else, all of a sudden found yourself working from home, working through technology, meeting people in that way. And really a time when patient advocacy organizations were wondering, oh my gosh, how do we shift our model to continue to support patients who had never been sort of at greater peril, if you will, in terms of how do they engage with the healthcare system during that time? How do these patient organizations provide support? And so we created something called the COVID Advocacy Exchange.
Yep.
This was, I think, a first in both the pharmaceutical industry, but also in the patient advocacy space of how do we step into this gap? How do we come together as a patient community to support patients? I have to give a ton of credit to Dave Craig at Grit Health. They really provided the platform that we used to initially bring people together. And Kathy Traz, who was the leader of the patient advocacy function at Bristol Myers Squibb, we put our heads together and said, there's something we can do here to bring patients, patient advocacy organizations, and industry together at a time when there was just a lot of scrambling and a lot of uncertainty.
Mm-hmm. Mm-hmm. It's interesting when I was looking back at that, and of course we'll talk GE Healthcare in a little bit. But during your time, as you mentioned at BMS, there's the COVID Advocacy Exchange, which sort of morphs into the Advocacy Exchange, which is has a much broader purview. And I found it really interesting. One of the core things that you were involved in there was these programs of addressing the gaps in clinical trial access. And we normally think of these things. All right, here I have this condition. I've reached the end of standard of care, and okay, I got some clinical trials here I can get into, but that's a tough world on its own. But when you take it one step further in terms of, everything from cultural differences, linguistic differences, there's a bunch of stuff piled on top of all that. We have major disparities in this country and elsewhere, and just in terms of getting into proper clinical trials for unmet medical needs. Talk about a little bit of your work on that space. I think it's an important piece of your story and what we're going to be talking about in a bit.
It's interesting, Ira. In 2011, my dad was diagnosed with a very rare form of renal cell carcinoma. Because I was in the industry, I knew how to navigate and quickly get him into a clinical trial. In fact, I knew some of the experts in renal cell carcinoma because I was at Wyeth at a time when we launched Toracell. So I literally, you can't say media trained, but media trained experts to support the launch of this drug, right? And that gave me the opportunity to know the right people, that when devastating news was delivered to my family, I knew how to navigate quickly, right? I've often said, I don't know what I would have done if I had been a school teacher or a bus driver or any other career not touching healthcare, in terms of how do you quickly navigate when something devastating, you have a devastating diagnosis, someone in your family has a devastating diagnosis. Many of us in the industry have that same experience, where we feel incredibly fortunate to know how to navigate. And so the opportunity through the COVID Advocacy Exchange was to share that perspective and open that aperture for others, right? The lack of clinical trial diversity is it's a complicated subject with, different people bringing different perspectives to what does it mean to join a clinical trial?
Right.
What is a clinical trial? What am I giving up by joining a clinical trial? Right? There are books written on it. We don't have to go into Tuskegee and Henrietta Lacks and all of those sort of perspectives that are a part of this broad story. At the end of the day, joining a clinical trial can ensure that you get the best care possible, right? And so demystifying some of those things was an opportunity of many issues and topics that we explored as part of the Advocacy Exchange. The Advocacy Exchange is alive and well today, I'm proud to say, and is still answering patients' questions about things like where and how do I get the best care? How can I connect with resources? What if I have questions? And what I love about it is that it's disease agnostic.
Yep.
It's all diseases. It's cardiovascular, it's oncology, it's mental health. All of these things are so intertwined when you receive a diagnosis. And so it's a great platform for just educating yourself and connecting with organizations that had very specific expertise and a commitment to help you as a patient. I look back at that time and I think it was such an important investment that BMS made, but it wasn't that much money. It actually wasn't even about the money. It was more about the opportunity to step into a space and to fill a gap where we as a company saw a gap. And so much about answering health equity challenges today is about having the courage to step and say, first of all, I see a gap. And second of all, I have a capability or an expertise or an opportunity to fill the gap, right? That's part of why I'm so excited about the GE Healthcare Foundation. Is we were very thoughtful as we looked at where does GE Healthcare have a capability, and we're not going to be a huge foundation, so where can we have an impact? And it took us about a year to really assess what's the right opportunity for us.
Mm-hmm. Mm-hmm. And that first opportunity, and sad to say, this is not the first time we've talked about this on the show. And I put this in the category of sort of the one of these invisible pandemics, because again, just looking at the numbers per maternal mortality, I'll just rattle some of these off because we talked about them before. Over 800 women every day dying from preventable childbirth-related complications, over 6,000 babies first day of life, and then this pathetic number of close to 50 million children under age 5 projected to die because of malnutrition, and then just all the common pneumonia, diarrheal diseases, things of this nature. And then on top of all this, as you know, I don't know, obviously sitting here in the United States, I think, all right, we got this problem under control, I guess. But the United States is on the list of, we're the only high income country in the world where maternal mortality is on the rise. Like, it's 2024. Are we doing something odd here? Talk a little bit about these issues, Danielle. I'd really love to. And then, of course, we'll go into understanding why GE Healthcare picked this one is obviously, kind of, right in our faces. But talk about some of these dynamics and sort of where we're going wrong on something that I think most people who talked about this think, I thought we had this one under control.
Right, right. It's shocking, isn't it? It's really shocking. I was quite surprised as we delved into this to see that the United States is trending in the wrong direction, particularly when you look at Black maternal health. It's really shocking. And it's something that we should be rallying around, focused on, and doing something about it. We just celebrated Black Maternal Health Week 2 weeks ago, where we took a week and we really focused on the crying need for both focus and action around improving Black maternal health in the United States. Preterm birth is a leading cause of infant mortality and morbidity in the United States. That's birth before 37 weeks of gestation. In 2022, the rate of preterm birth among African American women was 50% higher than the rate of preterm birth among white women. That's unacceptable. I know a little something about preterm birth. As a first-time mother many years ago, I had a baby prematurely. I woke up in a pool of blood. I was a first pregnancy. I had no idea what was going on. I just knew it was wrong, right? But thankfully, I had access to a wonderful hospital, a great doctor, a team that moved very quickly. And though my daughter came home, weeks after I did, she today is a healthy, thriving young woman making a positive contribution to society, right? That's not every woman's experience. In fact, your zip code can determine whether or not you get great care or suboptimal care. Rural women experience far greater, complications with the healthcare system around maternal care. And so this is really an area where GE Healthcare's foundation really thought, okay, we can, with a modest investment, make a difference in this space. And so, I never envisioned that I would be part of launching a foundation. It's kind of a once in a lifetime opportunity, right? To really set the course for how are we going to make an impact? So really proud that this is the area that we've chosen.
Absolutely. And take us a little into, how the foundation was started. Obviously, it's part of GE Healthcare, which was until last year part of the larger GE organization. And, thinking a little bit about my own time in pharma, about sort of the different investment models, right, that we had. So, we had our drug development, but then we also had our internal venture fund, and we had impact investing, we had philanthropy. Talk about how the decision was made to, all right, this is obviously you picked the right target, but then why a foundation, why philanthropy as the ultimate model?
Yeah, so maybe I'll start by giving you a bit of background. So General Electric is a 130-year-old plus company. In 2023, GE Healthcare spun out of GE and became an independent company for the first time, standing on its own, wholly focused on healthcare, having been a part of an industrial sector for many, many years, right? And so as a company, we had an opportunity to step back and say, we're going to be very intentional about the decisions that we make. Now that we own it, we're responsible for it. And so across our organization, I think, leaders were stepping back and saying, how do we want to operate? How do we want to show up? How do we want to communicate who we are as an independent company. And so in our first year, we asked ourselves a lot of questions. I would say it was never a question as to whether or not we would establish a philanthropic entity. That was a given from the get-go. It was just a question of how large of an entity were we going to be? What was our focus going to be? What were our priorities and sort of our must-haves, if you will. And I would say a couple of guiding principles were that we weren't going to be huge, and so we had to be very focused. We wanted to be in an area where we could have an impact and a measurable impact. We wanted to partner with organizations who had the expertise at the local level they were proven. They could get the job done, right? You can look across and say, does the world need another cancer-focused organization? And if we were going to go into cancer, which one? And could we have an impact, right? That's such a crowded space. Cardiovascular, such a crowded space. Not that these aren't important, but crowded, and there are lots of organizations doing great work. We wanted to focus on an area where we could be additive, where we could leverage the strength of who we were as a company. We have a long history in maternal and infant care. We are at every step of mom's journey. We're in the obstetric office. We're in the hospital. We're in the neonatal unit. We're in the well care. And so we felt like we had a capability and a legitimacy that we could bring to the discussion as we sought partners in our first year. And so we incorporated probably July, August of 2023. We established a board for the foundation made up of GE officers. We spent a lot of time thinking about how do we launch this new entity? How do we communicate who we are, what our intention is? How do we not overpromise, right? And how do we ultimately deliver? And so we have several partners that we can talk about. We launched the foundation at South by Southwest in early March. A great forum to meet like-minded and active and engaged organizations who are, intent on making good in the world. And so we sat down with a couple of our grantees, and we really used the platform to raise awareness of the need for focus on maternal and infant care, not just in the United States, but globally. And our intention is to be active around the world in this space.
And yeah, I mean, even though you say you're a small organization, you clearly are, global in the sense of some of the initial grantees and investments you put out there. I guess, if you want to start stateside here and talk about a couple of these initiatives, namely the Urban Institute, which is interesting, relating, not just in obviously, addressing the equity issue and looking at Medicaid policies, but sort of bringing in sort of the whole AI and machine learning component to help reduce these disparities. But then there's also the Black Mamas Matter Alliance, which has a really interesting structure, including this health incubator hub with a focus on maternal and perinatal and reproductive health care. Why don't we start United States side and talk a little bit about these initiatives?
Happy to run you through sort of the decisions that we've made and the partners that we're really proud to, work arm in arm with and provide funding support. So I mentioned we went to South by Southwest in March. Joining me there was Ash Rogers from Lawala. Lawala is an organization in Kenya. It is a Kenya-funded Kenya-founded, Kenya-led organization focused on improving health outcomes. They're really experts in their community, and they believe in making the community the center of focus and empowering local leaders as change makers to really address the cycles of inequity. And so when we sat down with Ash and her team, we thought this is exactly the type of partner that we want to work with, somebody who's has that local expertise, knows their own market, their own community, and can responsibly direct the funding toward training at the local level, toward implementing the right technologies, to providing educational resources for nurses and clinicians, really focused on obstetric ultrasound, increasing access for pregnant women. And so we're excited to partner with Lawala and to reach women in Kenya. As I said, it was important for us to select projects that were global in nature, where we felt we could really have an impact. So you mentioned the Urban Institute. So Carla Willis was also with me in Austin at South by Southwest. She's a researcher. This is a research-based organization that provides data and evidence to help advance upward mobility and equity. So we're partnering with them to create a public knowledge base, if you will, of the U.S. Medicaid policies and practices related to the use of AI and algorithmic methods to help reduce maternal health disparities. AI is only going to be as good as the information that we put into it. And so in order to address bias, which can often these algorithms just focus on cost, just focus on reducing cost. They don't focus on many of the other factors that contribute to maternal health. That's really the work that we're doing with the Urban Institute, is to focus on those algorithms and to ensure that the information that the algorithms are including will address and eliminate bias. And so I'm very proud to partner with the Urban Institute on this work. Black Mamas Matter Alliance is another grant partner of ours. This is a national network of Black women-led and Black-led birth and reproductive justice organizations. So it's an alliance. It's an organization focused on changing policy, leading research, advancing care for pregnant Black women, and really shifting our culture, raising awareness of the issue and helping create the culture to support Black women as they go through the pregnancy journey. Support from the GE HealthCare Foundation will help Black Mamas Matter Alliance to raise awareness of and foster tangible improvements in Black maternal care through a number of initiatives. I talked about Black Maternal Health Week earlier in April. There's a training institute and a pilot program to inform its Black Maternal Health Incubator Hub. So we are supporting that, which is a learning space for Black maternal, perinatal, and reproductive health workforce. For this pilot, the topic will be inclusive perinatal care, and the Incubator Hub will seek to advance the capacity of Black-led, community-rooted organizations serving majority Black birthing people during the perinatal period and across the reproductive care life of Black women. So really supporting that equitable care for Black women. And then in September, Black Mamas Matter Alliance will host its biannual Black Maternal Health Conference and Training Institute, and will provide support to that. That brings together all stakeholders, Black women, clinicians, professionals, advocates, working together to improve maternal, sexual, and reproductive health across the Black reproductive experience. So really proud to support that organization. And then finally, Project Echo, which is a program that will address maternal health in Indonesia. So Project Echo, you're probably familiar with, large network focusing on increasing capacity, resilience, and collaboration among public health workforce. We're focused on Indonesia. Our project will focus on funding capacity building of primary health centers in the region to successfully navigate the continuum of maternal and child health care, touching on topics like maternal nutrition, child stunting, pre and neonatal maternal care, and safe delivery and family planning. So that's a lot. As I said, we were really disciplined and focused when we were seeking partners in terms of where we could have an impact, where we could yield data, and where we can present our learnings, right? Share what we are learning as we go so that we improve maternal health, for the future.
Yeah, I'm glad you brought up Project Echo, because I just last week I did an episode with Dr. Ahmed at ICDDRB in Bangladesh, and I never really thought of child stunting and didn't really understand what it was, but this whole concept that it's not just, hey, this is affecting growth and development, but learning, and then also the whole cascade of everything that happens after that in terms of moving on to the educational system and jobs. It was much more connected than I understood, and so I was very intrigued and happy to see that Project Echo was focusing on that as part of the primary health center. So that was very timely and exciting. So these are the four initial projects. What is the process, if there's a promising organization that wants to work with the foundation that's in the sweet spot? How many projects are you looking to connect up with? What is the process of proposing to the organization? Walk us through a little of that, if you would.
Sure. So we're talking with organizations every day. You can imagine that when we launched in March, our phone lines lit up with opportunities to partner with different programs, with different initiatives, many worthwhile organizations that are doing great work out there. We have a spot on our website, so you can go to the gehealthcare.com website and find the foundation page where you can reach out and ask for more information, set up time to talk with us. We are a small but mighty force, I will say. And so, we are keeping a database of organizations that have expressed interest. And so I would encourage folks to go to our website to learn more.
Excellent. And we will obviously put the link in the bio of the show. Danielle, before you mentioned, as we were talking about the Urban Institute and the artificial intelligence component of what they're doing, and then again, there's a inclusive and responsible AI charter per your organization. Thinking about some of these technologies, innovation, emerging technologies, whether it's AI, whether it's some of these interesting tools that we've been profiling in the area of digital health and wearables, whatever. What else gets you excited in terms of the technological side of this? Because clearly there's a lot of great organizations. What are some of the things that you personally are interested in seeing further develop, specifically as it focuses on this topic of maternal health?
Yeah, so GE HealthCare is making significant investments in our digital infrastructure and in our capabilities. Our intention is to bring AI to our devices to really create, greater efficiency for clinicians, to really help reduce a lot of the administrative tasks, the handling of data management, introducing operational efficiencies that frees clinicians to spend more time with patients. Right? When you think about rural communities. Think about the power of handheld technology, of mobile
Right.
technology.
Yep.
It can be a game changer for remote care settings that, you know, don't have the infrastructure or even the patient base that would necessitate the infrastructure, right? And so we're investing in those technologies. GE Healthcare has an installed base of over 4 million devices. Imagine if those devices were all talking to each other. Imagine, if you're a clinician, that the data from those devices comes to you in one place at one time, right? You can really cut down on the time it takes to gather all that data and make an informed diagnosis. And so AI has the potential to be a game changer in accelerating diagnosis, in creating more accurate diagnosis. So imagine for moms, having all of that at the clinician's fingertips. I really think there's a huge opportunity there.
Absolutely. Are there, I mean, I know there's other, topics that the foundation is going to be focusing on. I don't know if those are public yet, but anything else that you can tell us about sort of target number 2 for the foundation, or if that's confidential and still in the planning phase, no worries, but please.
Well, as I said, our initial focus is maternal and infant care. We really see an opportunity to make a difference there. From there, a natural extension could be into women's care, women's health. It could be into cancer and women's cancers. And so probably following a trend line that looks like that. I would say, we're 1 month into it. We're just getting started.
Sure.
And so, our intention is to learn as we go, to learn from our partners, and to share what we learn.
Right.
At the end of the day, everyone will benefit from the projects that we're funding, but only if we share what we learn.
Absolutely. Yeah, and it's been interesting because, as I've done a few shows in the area of women's health, it's amazing how to say the disparities that still exist in our understanding between what makes a man and woman different, and the biology and everything else. So yeah, there's a lot of other pieces to the equity equation there that it's going to be exciting to see go down that path. What else is coming up for you in terms of 2024? I mean, you mentioned, unveiling the foundation at South by Southwest. Other conferences, other public-facing stuff that we should know about in terms of where you're going to be, talks you're going to be giving, conferences, places we could run into you possibly and listen to you talk. Anything else on the calendar that you want to mention, please?
Oh gosh, lots of opportunity, I would say, to engage with the foundation. We will be at PQMD next week in New York, talking. We have, hopes of being at the UNGA in September. So still, working on, I would say, our schedule. But lots of opportunity, I think, to continue to share our vision for the new GE Healthcare Foundation. We'll be active on social, so you can check us out there through the GE handles, the GE Healthcare handles, and then through our partners, Lawala, Urban Institute, Black Mamas Matter Alliance, and Project Echo will also be communicating and sharing, updates about our co-created work.
Outstanding. We will put the links to all those initiatives as well in the bio of the show. An amazing initiative, Danielle. I am excited that we have the opportunity to profile it here so early in its development. Would love to do a follow-up with you next year possibly to see how everything has progressed. But really excited for you and rooting you on in this area of extreme unmet medical and social need. Again, for everybody that's going to be listening to this particular episode of our show across the various podcast networks, or who will be watching on our YouTube channel, again, you've been spending time with Danielle Halstrom, president of the GE Healthcare Foundation. Danielle, I really want to thank you for taking the time out of your schedule to talk to us for a little while, to educate us on what you're up to there. Obviously, thank you for everything you do for mothers and children worldwide. And as we like to say on our show, thank you for creating a better tomorrow for everybody via what you're doing at the foundation. It's a really great story, and I look forward to continue to talk to you and follow up next year.
Well, Ira, thank you for using your voice and this opportunity to bring attention to maternal and infant care and just the important opportunity that we have to improve the lives of moms and babies. Very proud to be here on behalf of the GE Healthcare Foundation.
It was great having you, and really wishing you the best with it.